So your physician has now recommended Stivarga or regorafenib for the treatment of metastatic colon cancer for your disease. And it's a little different. It works as a targeted drug, so cancers have broken genes, and it's like somebody has gone into the fuse box and mucked with the switches. Well, what this medicine does is go in and tries to restore those switches so the cells behave more normally. So-called targeted therapy. But just because it's oral and just because it's fancy targeted therapy doesn't mean it doesn't have side effects. These medicine does have some side effects on the hands and on the feet, and can be some fatigue. And we're all debating about what the exact right dose is. So you'll have a discussion with your physician about the standard dose and maybe some different doses to try and reduce some of these side effects. Now, most of the time, patients are really focused on their CEA levels and the size of their cancer. They want to see it get smaller. They want it reduction. They want the CEA to fall. But the reality is, after that initial chemotherapy, we often don't see much reduction, and our real goal becomes one of stabilization. And that's what this medicine can do. It can stabilize the cancer, keep it from growing in about 40 to 50% of patients, and about 1 in 5 of you will have stabilization of your cancer for a half a year or more. So we're seeking to control the cancer, keep it from growing, keep your quality of life high by appropriately dosing this, and of course extending your survival so you can make it to that next event in your life. You know, we know this patient a lot. You know, you've talked to them 1,000 times, right? You know their families, kids, all of that, right? We have a sense of their social support. So now we come to the next decision of, all right, we've got 2 agents in refractory setting. We have TAS-102, we have regorafenib. You know, how do you go about picking a patient who's the right one for what drug?
Sure. No, as you mentioned, after a while, patients become too part of your own family, and actually you become part of your own family, and you know them very well, and even you start to know like your life, your kids, your wife, all that stuff, and vice versa. And one of, I think, of the important benefit of that is that you can tell what's important for them, even without them saying that. And as a clinician, one thing you want to make sure, yes, your drug will work, or hopefully it work, but also you want to make sure the side effect fits their lifestyle profile, especially in that kind of stage. The refractory, they already received a lot of treatment, as you mentioned. So, for example, if I have somebody who's like to play guitar, I might choose not to give him Stivarga, not because of anything, but because of the hand-foot syndrome that affected his lifestyle. I had a patient who actually was going to play in a concert, and that was a determining factor. If somebody he kept having infection one after the other and low count, I might shy away from losing Lancer because of the count problem. So you have to tailor your therapy to what fit really for that patient. I think, in my opinion, colon cancer is a family name. I always think every individual person like is the son and daughter that shares the same family name, but it's different in own character.
Yeah. I know, Monica, you have a lot of experience with both these drugs and managing it, you know, from your side, from the nursing side. Are there issues that sort of distinguish where one patient you think might be better Lonsurf, one patient might be better Stivarga?
I think it's kind of like Dr. Salem said, a lot of times it comes down to side effects. So for many of you, this might be the first time that you are taking an oral drug. You're about to start Stivarga or regorafenib. You might be used to coming into the infusion center every week. The nurse is there, she gives you your medication, you go home. This is going to be different because now it's kind of on your terms. You're at home, are you remembering to take your pills? You know, it's all in your court now. So a couple of key tips that it's really important to remember is, number one, try to take the medication at the same time every day. Some people might take it in the morning with a low-fat breakfast. Sometimes doctors might even recommend that you take it after dinner, and that's okay too. Another thing is that there might be some side effects of medications. It might be something different than you've had before. You might be experiencing some nausea, some vomiting. You might also start to notice that your hands have some redness, some dryness, or some soreness. Those are common side effects of medication, but just because those are common side effects, we still want you to be telling us. I tell my patients every time as soon as they start this med, I want them to over-communicate rather than under-communicate. Even if they think it's something small and insignificant, I want them at least to shoot me an email and tell me about it. That way I can tell them, don't worry about it, it's fine. Because sometimes it's the small things that if we stop them early, then it can prevent complications later on.